And I am blessed to have Peninah Ochola with us in the studio today. Hello, Peninah.
Hello, Ruth.
Welcome to Impact Radio. Now, you work for Amref. You are the South African Country Director for Amref. And Amref is the African Medical and Research Foundation. It's an international African organization with its headquarters in Nairobi, Kenya, which is where you are from.
Yes.
So tell us just very briefly, put us in the picture, what is Amref all about?
First of all, Amref was founded in 1957. We are like 54 years old by three surgeons who used the tools of their time at that time, the aircraft, to reach the remote and reachable communities of Eastern Africa. After that, the organization has evolved to become a recognized public health institution working in Africa. We do consultancies with 30 countries of Africa, but we have program countries in 7 countries, including South Africa. We believe that the power of lasting transformation of African health lies within its communities. And life and wealth-producing communities are the very fabric of life. And that's why our core business is around community partnering with communities, empowering them to be able to respond to their own issues. We do build capacities of both the service providers and community resource people. We are concerned about the health system strengthening with the governments of the countries where we work. Our great partner, the most important partner, is the government, the ministries of health, and the community-based organizations.
Right, you guys have a tremendous job in your hands. Tell us, what is the current picture regarding health across Africa? I'm assuming it's not too good.
Definitely it's not too good, and Amref obviously is concerned. That's why we choose to partner with the governments of Africa. The Africa health burden obviously is a concern for even the governments of Africa. The burden, given Africa is only 12% of the world population, but represents 50% of all deaths within the world. That's too much of an issue. And mothers and children really bear the brunt. And because they bear the brunt, it's a situation that doesn't seem to be getting over, because the factors that drive these mortalities and morbidities, the situation of HIV in Africa, the story of HIV, of malaria in Africa, maternal pregnancy-related deaths, when women die when they're delivering. We haven't been able to grapple with that. And that's why the world, when they met in 2000, 189 countries met to talk about Millennium Development Goals. And the 3 of those are concerned with health. One is the reduction of maternal mortality by at least 2/3 by 2015. The same reduction for child mortality by 2015 by 2/3, and again the reduction of HIV prevalence by 2015.
So how close is Africa as a continent to reaching these goals?
Our review has shown that we are not making very good progress. Even when the heads of states of Africa met in Abuja in 2001 to review, to see what they can do. Remember, they promised that they would put 15% more money into health so that we can revert the trend. But even a review 10 years later, very little has gone in. Resources are not adequate in Africa. Africa has very good policies and strategies, but the resources are not adequate enough.
So when you're saying resources, you're talking money, as in hard
cash? I'm talking money, I'm talking human resources.
Okay.
You need people to do the work. You need skilled people to do the work. You need people who can link with the communities and help the communities understand what they should be doing in their own communities to turn the tide. You need money also. You need comprehensive services. These are nicely written. They are good strategies, but to move this agenda as fast as we need to turn the tide is a little bit slow.
Amref, what do you guys do that is different, that can make a difference, that can empower communities to then begin to turn the tide? What is at the core of what you guys do that is maybe a little different?
The main core is the fact that we are well positioned in the communities. The fact that we can begin to linking communities and the health system is our core business. Linking them with the health systems that are strengthened, Amref builds the capacity of community resource people, empowers the community, sensitizes the community, mobilizes them to take action for their own health programs, and also help them to have an aware of where to get health services that are comprehensive and are of good quality. That means we have raised demand. When we do raise demand, we are also concerned that the demand could be overwhelming at the health facility. So we also work with health service providers, build their capacity to be able to understand how to work with the communities and be able to respond to community issues that are coming. I mean, our work does generate a lot of demand, but sometimes we find that when we are working with the health system, service providers are not adequate enough to be able to deal with the linkage that we are promoting. And so Amref is very community-based in its approaches to health, but also very multi-sectoral in terms of creating partnership alliances with different people in the community, different ministries that can bring some differences or contribute to the development, health and development of the communities that we work with. That's why that partnership with community-based organizations are very important, particularly targeting community-owned resources, including traditional healers, including traditional birth attendants, including anybody in the community that can be trained, whether you are literate or not, because we use methodologies of learning that are non-directive, that are psychosocial, that makes anybody who has never seen a classroom be able to also build on the experiences they already have and also contribute to the agenda. That's why we wish that when policies and strategies are being done in a country, that consultation with the communities become very paramount, because it's really the communities who know where the shoe is pinching.
Absolutely.
They're the ones who have buried the many children and the many women that we're talking about.
Yeah.
Their voice need to come to policy development and strategic design.
Definitely. So let's bring it right back to home. What's the outlook in South Africa, here in our communities, in Pretoria even?
Okay. South Africa, first of all, compared to other African countries, is sitting very well in terms of the health expenditure per capita. It's about $500 per person. But even with that, South Africa still also experiences very bad health indicators. The Minister of Health you had the other day talk about deaths of children, talk about deaths of women, meaning that we even with the resources we have, something is not quite working fast enough to turn that tide, even in South Africa. If you look at that data, particularly for maternal mortality, very comparable with other African countries. But this country has a lot of resources. This country could be doing more to really use those resources. But I guess also as we do good policies and strategies like South Africa has very, very good policies. The willpower is there. The commitment of the government is there. But I think we are falling short somewhere. Could it be because, not could it be because, most of the services that we see in South Africa are very curative based. And the government is aware of that.
All right, we need preventative.
We need preventative, we need promotive, we need all the works. And that means you have to involve the communities and link with the communities to make sure information is accessible and people can access quality services, that the people that we put in health providers also have a way of communicating with communities, because it requires a special way of communication.
So if we have health professionals who are listening in right now, people who are working right there in the communities and who are in the medical field, and they would like to get in touch with you guys, with Amref, work in conjunction with you, could you give us some contact details, please, Peter?
Yes, they can go to our website. Our website is www.amref.org. We also have a Twitter at Amref in South Africa. People can get in touch with us from those tweets.
Peninah, would you like to leave us with one final message to our listeners about the difference that we can make health-wise in our communities?
We can make a difference. Let's stand up for African mothers and children. That is the message that Amref is using as an advocate. Let's be passionate about what we can do to make a difference. Let's pool resources. Let's form alliances. Let's make mothers and children a priority in our country, in our community, at our households.
Fantastic. Thank you very much for joining us. Today we've been joined by Peninah Ochola Odiambo. She's the South African Country Director for Amref, the African Medical and Research Foundation. Yeah.